If you're over 50 and waking up tired, stiff, or in pain, the problem might not be your mattress or your age. It could be the way you sleep every single night. Tonight, I'm going to show you 4 sleeping positions that silently damage seniors' health, and 4 safer positions that can dramatically improve sleep, breathing, and circulation starting as soon as you lie down. As we age, our bodies become far less forgiving. Joints lose cushioning, blood circulation slows down, breathing becomes more sensitive, and the spine is less flexible than it used to be. That means the sleeping positions you got away with in your 30s or 40s can start causing real damage in your 50s, 60s, and beyond, sometimes without obvious warning signs. Many seniors think pain, acid reflux, numb hands, snoring, or frequent night waking is just normal aging. But in reality, research shows that sleeping posture has a direct effect on spinal health, heart function, digestion, and even brain oxygen levels. The wrong position night after night can quietly worsen arthritis, raise blood pressure, compress nerves, and reduce deep sleep. Let's start with the first sleeping position seniors should absolutely avoid. The first worst position is sleeping flat on your back without any support. This might sound harmless, but for seniors it can be surprisingly dangerous. When you lie flat on your back, gravity pulls the tongue and soft tissues backward. This narrows the airway and makes breathing more difficult, especially for older adults. This is why back sleeping is strongly linked to snoring and sleep apnea, both of which reduce oxygen to the brain during sleep. Low oxygen levels at night don't just make you tired the next day. Over time, they increase the risk of high blood pressure, heart disease, memory problems, and even stroke. Flat back sleeping also places stress on the lower spine, especially if you already have arthritis or disc thinning. The natural curve of the spine flattens, which can trigger lower back pain that feels worse in the morning than at night. Another issue with flat back sleeping is acid reflux. As stomach muscles weaken with age, lying flat allows stomach acid to travel upward more easily. This leads to nighttime heartburn, coughing, and interrupted sleep, even if you don't feel classic reflux symptoms. The second worst sleeping position is stomach sleeping. This is one of the most damaging positions for seniors, yet many people cling to it out of habit. When you sleep on your stomach, your neck must twist sharply to one side for hours just so you can breathe. This prolonged rotation puts enormous strain on the cervical spine. For older adults, this can worsen neck arthritis, compress nerves, and reduce blood flow to the brain. Many seniors who wake up with headaches, tingling arms, or shoulder pain don't realize their stomach sleeping is the cause. Stomach sleeping also forces the lower back into an unnatural arch, increasing pressure on spinal joints and discs that are already fragile with age. Even worse, stomach sleeping restricts chest expansion. That means your lungs can't fully inflate, leading to shallow breathing throughout the night. Over time, this reduces oxygen delivery and contributes to chronic fatigue. The third worst position is sleeping curled tightly on your side, almost like a ball. While side sleeping can be beneficial, curling too tightly causes problems, especially for seniors. This position compresses the chest, limiting lung expansion, and puts pressure on internal organs. When knees are pulled sharply toward the chest, blood circulation can be restricted, particularly in the hips and legs. This can worsen numbness, leg cramps, and even contribute to restless sleep. For seniors with arthritis, this tight curling also stiffens joints overnight, making morning movement painful and slow. The fourth worst position is sleeping with your arms raised above your head or tucked tightly under your pillow. This position compresses nerves in the shoulders and neck, especially the brachial plexus, a network of nerves that controls arm and hand sensation. Seniors often wake up with tingling fingers, numb hands, or shoulder pain because of this habit. Over time, nerve compression during sleep can worsen existing nerve damage and reduce grip strength. It can also interfere with circulation, especially in people with diabetes or vascular issues. Now, the good news is this: small changes in how you sleep can lead to big improvements in how you feel. You don't need expensive equipment or medication. You just need to use positions that support your aging body instead of fighting against it. In the next part, I'll walk you through the first 2 safer sleeping positions that seniors can start using tonight to protect the spine, improve breathing, and wake up feeling noticeably better. Let us now talk about the safer sleeping positions, the ones that actually work with your aging body instead of against it. These positions are backed by sleep science and commonly recommended by doctors for seniors dealing with pain, breathing issues, circulation problems, or poor sleep quality. The first better sleeping position is side sleeping with proper support. This is widely considered the healthiest position for most seniors when done correctly. The key is alignment. When you lie on your side, your ears, shoulders, and hips should form a straight line. This keeps the spine neutral and reduces pressure on joints. Placing a firm pillow between your knees is essential. As we age, hip joints lose cushioning, and without knee support, the top leg pulls the spine out of alignment. A pillow between the knees prevents this twisting and reduces lower back and hip pain. Many seniors report waking up with far less stiffness once they adopt this simple habit. Side sleeping also improves breathing. Gravity helps keep the airway open, reducing snoring and the severity of sleep apnea. This leads to better oxygen levels throughout the night, which supports heart health and brain function. In fact, studies show that side sleeping may help reduce the risk of cognitive decline by improving the brain's ability to clear waste products during deep sleep. For seniors with acid reflux, sleeping on the left side is especially helpful. The stomach sits lower than the esophagus on the left side, making it harder for acid to travel upward. Many people experience immediate relief from nighttime heartburn just by switching sides. The second better sleeping position is back sleeping with elevation and support. Unlike flat back sleeping, this position uses pillows strategically to support the spine and airway. A pillow under the knees maintains the natural curve of the lower back and reduces spinal pressure. Slight elevation of the upper body, either with a wedge pillow or adjustable bed, helps prevent airway collapse and acid reflux. This position is particularly helpful for seniors with arthritis, spinal stenosis, or circulation issues. Elevation reduces pressure on the heart and can help decrease swelling in the legs and ankles. It also minimizes facial pressure, which some believe may slow wrinkle formation. However, the key here is moderation. Too many pillows under the head can push the neck forward and cause strain. The head should rest in a neutral position, with the chin not forced toward the chest. The third better sleeping position is side sleeping with a slight forward tilt, often called a relaxed fetal position. Unlike tight curling, this position keeps the knees slightly bent but not pulled tightly to the chest. The spine remains long and breathing stays unrestricted. This position is excellent for seniors with lower back pain or spinal arthritis. It reduces pressure on spinal discs while still offering the benefits of side sleeping. Adding a small pillow behind the back can prevent rolling onto the stomach during the night, which many people do without realizing it. The fourth and final better sleeping position is back sleeping with leg elevation for circulation support. This is especially helpful for seniors with varicose veins, leg swelling, or circulation issues. Elevating the legs slightly just above heart level helps blood return more easily to the heart and reduces pressure in the lower limbs. This position should be done carefully. A pillow under the calves, not the knees, ensures proper support without bending the joints unnaturally. Combined with a supportive pillow for the neck and shoulders, this position can dramatically reduce nighttime discomfort and improve morning mobility. It's important to remember that changing sleep position doesn't happen overnight. Your body has habits formed over decades. The goal isn't perfection, it's progress. Even spending part of the night in a healthier position can bring noticeable benefits over time. In the final part, I'll explain how to transition into these better sleeping positions easily, what to expect during the first week, and how to know which position is best for your specific health concerns. Add a pillow under your knees first and see how your lower back responds. The body responds best to gradual adjustments rather than sudden extremes. If you struggle with joint pain or arthritis, side sleeping with proper knee support or back sleeping with leg elevation can significantly reduce stiffness. For circulation issues, gentle leg elevation can make a noticeable difference in swelling and comfort. The body naturally moves during sleep, and that's healthy. With proper alignment, gentle elevation, and smart pillow use, sleep becomes a time when your joints relax, your breathing improves, your heart works more efficiently, and your brain gets the oxygen it needs to stay sharp. Tonight, when you lie down, you have a choice: keep sleeping the old way, or give your body the support it deserves. A small change tonight could make a big difference tomorrow.